My name is Deepak Komath. I'm a maxillofacial surgeon. I work at One Hatfield Hospital for my private work, and for my NHS work I work at the Royal Free. So TMJ is the accurate name of the jaw joint, and everyone has one on either side of the face in front of the ear. It's about 1.5 centimeters deep to the skin. This is the joint that articulates the lower jaw to the base of the skull. TMJ disorder, TMJD or TMD, is any situation where you're either restricted in function or suffering from pain or having any symptoms from your jaw joints. And these could range from anything from a click or a grating sensation from the ear, which could even be audible to another person. Or it could be pain which is localized to the area in front of the ear or to the side of the face, extending to the temple and down to the back of the neck as well. So TMD could be as a result of an inflammatory process or a degenerative process of the actual joint. So an abnormality of the contents of the joint, so to speak, and also pain associated with the muscles that move the jaw. So this, in a nutshell, is what is termed TMD, or Temporomandibular Joint Dysfunction. And it could restrict people from opening their mouths, could cause them quite severe pain, intermittently often, ranging from 8 to 9 on a scale out of 10, and also long-standing chronic low-grade pain as well. And then there is the inability to chew food of certain consistency and texture. So there is quite a lot of disability associated with it, and it's quite widely prevalent in the population as well. You see it mainly in young females. The prevalence is almost twice as common in a young lady as opposed to a young gentleman. You do see it in the older population as well, and that is more to do with arthritis. But again, you can have, if you're suffering from generalized arthritis, rheumatoid arthritis or psoriatic arthritis, you can have that manifest as jaw joint arthritis as well. We have come a long way. We've evolved in our understanding of TMD, and we currently have a reasonable body of scientific evidence that drives treatment. My particular way or philosophy of managing a patient with temporomandibular joint dysfunction and pain is a multidisciplinary approach, where my patient has the access of allied specialists like a pain consultant, a clinical psychologist, a physiotherapist, and of course surgery through myself. In general, moved away from open surgery for the jaw joint with the advent of more evidence that closed arthroscopic procedures get very good results, and open surgery is reserved for the very late stages of the disease progression. I'd like to add that the cutting edge of arthroscopy allows you to not just diagnose conditions through a scope, you can also have procedures done through keyhole surgery, and that's very exciting. In general, you go through a process of identifying the cause of the problem. It could be, the problem could arise from the jaw joint itself. You want to rule out conditions like rheumatoid arthritis, for example. Focus your treatment, be it on the joint itself or the muscles that move the joint, or a combination of the two. So a lot of treatment is tailor-made for that particular patient. You start off with simple treatments. It could be simple painkillers. If you're treating painful muscles, you could massage, topical therapy, applying heat, modifying your diet to ensure that you go on a slightly softer diet, common sense advice like that. Then there is jaw joint physiotherapy, which is quite frequently prescribed to patients. A lot of these conditions are stress related, so you have an idea of what's going on in their lives a little bit, and if they require psychological support, that is available as well. Not everybody requires it, of course. There are certain specific indications for surgery, and most common surgeries that I would perform would be an arthroscopic procedure, where you use a small telescope that goes into the jaw joint. What informs that decision is usually an MRI scan, which is reported by a specialist. You get a grade, you get an idea, and depending on how bad the internal degeneration of the joint is, then you can offer a simple diagnostic procedure where you wash out the joint and wash out any inflammatory chemicals that might perpetuate the degeneration and induce a lot of pain. To more advanced treatment, I also offer regenerative medicine, where you withdraw stem cells from the same patient and introduce it into the joint. The results are promising. The decision to go ahead and have an arthroscopic procedure would depend on a scan, an MRI scan report. Once that decision is made, you go ahead and have the procedure done. It's usually a day case procedure. You come in, have it done on the day and go home the same day. There wouldn't be an incision as such. There would be 2 or 3 little holes in the skin. You can bleed a little bit from it. You can expect quite a bit of swelling. It tends to be a painful procedure. So you are looking to be out of work for at least a week. You will need to go on a soft diet, and I will follow you up in clinic a few weeks down the line. You will be advised physiotherapy during your recovery period. So once the pain of the surgery subsides, most people, like I say, about 85%, tend to be pain-free. And providing there isn't any ongoing destructive process, like, for example, persistent clenching and grinding habits, or a disease process like ongoing rheumatoid arthritis that drives the disease forward, you could be cured of it. End-stage jaw joint surgery, where you have tried a series of treatments over a period of time, and your jaw joint function is so poor, and you're in quite a lot of pain and disability from your jaw joint, and you're unable to have a reasonable quality of life, you then consider jaw joint replacement as a last treatment. It is currently the gold standard treatment for end-stage jaw joint degeneration. The results are excellent, and there's a strong body of evidence that that is the case. These are a prosthetic joint that replaces the upper element and the lower element as required. There is an excellent body of evidence from this particular treatment, and the outcomes are very, very good indeed. In broad terms, about 85% of people will have benefit from simple treatments. Patients could be referred to me either directly through to One Hatfield or through my secretary via my website, which is facialsurgeon.co.uk.